Hello, my name is Dr. Nate Lighthizer, and I'm a professor and the Associate Dean at the Northeastern State University Oklahoma College of Optometry, as well as the Chief of Specialty Care Clinics here in Tahlequah, Oklahoma. I spend most of my time in Specialty Care Clinic, which is a referral clinic for ocular disease patients who have a variety of conditions from front half of the eye to back half of the eye. Eyelid anatomy is critically important to all of our patients from a very real functional perspective. You think about it, you've got to remember the eyelid anatomy and where those lids would normally land on the ocular surface, both the upper eyelid and the lower eyelid. A patient with a drooping eyelid can have a drastic effect on their well-being, state of mind, and most importantly, their functional vision. Reduction in superior field of vision has a real impact on patients. It can increase their risk of falls by 8 to 10%. It can also prevent them from wanting to drive or do other necessary activities, or just activities that bring them happiness and affect their well-being. Ptosis isn't hard to identify. The first thing I do is a general gross observation. You don't need to be behind a slit lamp to do this. When the patient walks in the room, when I walk in the room, just looking at them, is there any asymmetry of the eyelids? Is one lid higher than the other, lower than the other? And I also look at that vertical palpebral fissure. How open are the eyelids? From limbus to limbus, superior to inferior, it should be about 11.5 to 12 millimeters, again from limbus to limbus. But it's important to remember, what is the normal eyelid anatomy? Where do the normal eyelids land? The lower eyelid should normally land about at the lower limbus. The upper eyelid should land about 1 millimeter or 2 below the upper limbus. So if you've got 11.5 to 12 millimeters from limbus to limbus, but the upper eyelid covers 1.5 to 2 millimeters of that, the normal vertical palpebral fissure should be 9.5, 10, maybe 10.5 millimeters. And that's an important measurement. How open are the eyes? Is there a ptosis? Is there an asymmetry? And what's the degree of severity, mild, moderate, or severe? One of the most common causes of acquired ptosis is an aponeurotic or age-related ptosis. As we age, tendons and muscles stretch, they weaken. An acquired ptosis, or aponeurotic ptosis I should say, is just a stretching and weakening of the levator muscle and the attaching tendon, which acts as a fulcrum to hold the eyelid up as we go throughout the day. But ptosis can affect patients of all ages. I always rule out other causes of ptosis, like a congenital ptosis, meaning the patient was born with a droopy eyelid, or other acquired causes such as neurogenic, myogenic, or mechanical ptosis. If their pupils and their EOMs are normal, you have likely just ruled out a neurogenic ptosis, but ask patients how long it's been going on. So asking questions, knowing what the symptoms are and what the signs are can help you rule out a neurogenic ptosis. Don't forget about a myogenic ptosis, which is most often from myasthenia gravis. I think one of the most important questions that we can ask as eye care providers is, how are your eyes doing? But don't forget about the very important question, how are your eyelids doing? We get so busy and so focused on the eyeball from cornea to retina and everywhere in between that we forget about those very important eyelids. Ptosis, often a condition of patients in their older ages, 60s, 70s, and 80s, but there are patients in their 30s and 40s that may not be happy with their eyelid position. So these simple questions, how are your eyelids doing, may open up a dialogue and a patient comments, you know what, doc, I've noticed lately that my right eye droops a little bit more than my left, or vice versa. Maybe it's when I'm tired, or maybe you noticed something that the patient didn't. These simple questions open up the dialogue and can start a very important conversation. As a doctor, it's very rewarding to help patients, to treat patients, and to help them achieve the vision that they need to best live their life.